Okay, brilliant. Thank you very much, everybody, for coming today. We're going to make a start. So just like to welcome all to this webinar today to speak about innovation. So in terms of general housekeeping, if you could please make sure that your microphone and video are turned off during the session and really help with the quality of our call. If you need a break, please feel free to just drop off any time and then rejoin. The live captions is available. Again, everybody knows how to work that with in terms of your 3 dots. Sarah, who's running the event, will be recording this, so just so you're aware that it will be recorded. If you've got any questions, we do have the chat facility. I'm chairing the event today, so I will ask at the end of every presentation if anybody has any questions, and we'll get to them from the chat functionality. But I will also ask at the end if anybody doesn't get their question asked or has something that they want to ask at the end. And all of the presentations will be circulated after the event. So firstly, I'll just go through who is speaking today before I hand over to Richard. So first of all, we've got Richard, who's going to do sort of an introduction to the ABHI. And then I'm going to hand over to Dr. Stephen Lynn, one of our associate directors. I will do a couple of presentations, and then I'll pass you over to Rachel, Rachel Morris, who will do a presentation on our secure data environment. And then questions and answers at the end. So I'll hand you over to Richard Phillip, who is the Executive Director of Policy and Partnership at ABHI.
Jodie, thank you very much indeed. And for regular viewers from our membership will know this is part of a virtual roadshow we'll be doing around all our friends in the Health Innovation Networks. I think we're probably just over about halfway around now with a few more to go. And I think it's a program we'll be continuing. We've had some really great feedback. I really am. I'm not saying that just because we're virtually in the Northeast. I'm delighted to be speaking to you with our friends from Northeast North Cumbria today. It's the network, a network with a really great heritage of relationships with industry partners and the authors of the wonderful innovation pathway, which I think you'll see on at least 2 slides today. I noticed having a look through the thing, so that's really good. Listen, I get through this section in about 5 minutes because this is not about ABHI particularly. It's more about listening to some of the fantastic assets that they have on Northeast in Northeast and North Cumbria. But if you have the first slide, please, or next slide, please, Sarah. I just wanted to just give you a brief overview of what we do as an organisation, some of the things that are bothering us, and then some of the work you might want to get involved in, how you might be able to do that. Conscious there'll be some companies on the call who maybe don't even know there are such things as industry associations, let alone how they contact them. So what we do, probably our major role is acting as an interlocutor between the industry and government. So there isn't a day goes by when we're not speaking to government officials about matters of policy and trying to shape the policy environment. Our members get the opportunity to engage in and shape those discussions. We have particular expertise in regulation. I'll say a little bit more about that, as well as relationships across the NHS. We have a number of regional partners, many of whom met at our conference this week on Monday evening for a reception. We also offer insight and intelligence. If you just joined us and all you did was read our comms, you'd be better informed than most of your competition. It's the best of its type. It's written by the industry for the industry, and of course we offer an enormous amount of networking opportunities through our events. We've had probably over 300 people through our 2 days of our annual face-to-face conference, which was held in London on Monday, Tuesday this week. We also have a network of around 30 different working groups where you have the opportunity to sit in a safe environment and meet with peers and get the opportunity to stay on top of what's happening. We do quite a bit of work on international, and I'll say a little bit more about that later. And we're broadly representative of the industry. We have 400 members, about 80% or more of which are SMEs, which obviously characterise this sector so much. And whilst we recognise there are another 4,500 companies out there, largely SMEs, or with a particular emphasis on the S, we're cognizant that we have an obligation to speak for those through. That said, our membership probably accounts for about 80% of the value of the industry in terms of sales to the NHS. So the next slide, please, Sarah. This tells you a little bit how we organise ourselves, and this is quite important. We have various functions: regulation, as I've mentioned already; market access, how you try and make sense of the NHS as a market; policy and partnerships, which is what I look after, and communications. That's then split into our business areas: digital health, which is a really, really burgeoning and important area for us. And I know people on the call, ABHI members, will be really looking forward to Rachel's presentation later on, because we've got real hope for the secure data environments, medical devices, diagnostics, and our international work. So that's kind of important, because it means we have breadth. We're not a niche organisation. We cover the entirety of health tech, so devices, diagnostics, and digital health technologies, but we can also bring some focus. And in the middle is just a very, very small snapshot of our stakeholders with whom we are interacting on a daily basis. You can see the Health Innovation Network, for whom we've been very, very long-standing supporters, and a couple of us actually sit on boards of HINs across the country. Next slide then, please, Sarah. This is gives you a sense of what we're working on. These are our priorities for this and next year. Now, they were approved at our board yesterday. We have 3 broad priorities: growth, regulation, and ESG. That is growth of the sector. We shouldn't be embarrassed about that. We're an industry association. Growth of companies in the sector, and growth of individuals within those companies. Regulation covers product regulation, also compliance, code of business conduct, and ESG is a very, very burgeoning agenda. And you'll see from those 3 priorities, we have a number of probably 10 key work areas. I'll mention just a few of them. Sustainability. We're conscious that the NHS has got serious requirements on its suppliers moving forward in terms of their net zero ambitions, and there's a roadmap for that. We commissioned some consultants to do a report on sustainability to support SMEs in that regard, which gives you some milestones and what you need to do by when, who's able to help you. Digital health I mentioned. We'd also do some work around equality, diversity, inclusion, and health inequalities. That is both our journey as an organisation, but supporting particularly some of the smaller organisations on there, and also health inequalities. We all know, don't we, that the most disadvantaged people in our society are the ones who have worse access to healthcare and worst health outcomes. So we're thinking very, very hard about that in terms of what role we have to play in that as an industry, whether that's in terms of trial design or the way we help deliver services more generally. So the next slide, please, Sarah. This is not one I'm going to go through. This is our Guinness World Record slide entry for the most number of words on one particular PowerPoint slide. But when you get the slides afterwards, if you want to come back for more information, this is our wheel. Well, we use it ourselves internally, actually, even though we're a relatively small organisation, to orientate ourselves around who's responsible for what at any given time. So do at your leisure take that away and have a look. And I think the final slide I'll leave you with is I mentioned our international work. We have a big international program to help companies who are in the market to export. If you are thinking at all of looking to get a foothold in the United States, I can promise you the most cost-effective method you'll have is to join our US accelerator. We run 5-6 or so missions a year to various US states. We have a physical accelerator based in Austin, Texas. In the course of a week's mission over there, you might expect to meet the senior clinical decisions, C-suite level individuals in 10, 12, 15 different large hospital systems. We also support a number of trade shows on just about every continent. The next big thing coming up in the new year will be Arab Health, but you can see we're present in Europe, Asia, and Africa as well. So I don't think that, Jodie, necessarily is a presentation that lends itself to any questions. If you'd like more information on this, then just please pop something in the chat. John Evans, our Director of Comms, is on the call. He'll feed some things into the chat about background to our membership, our brochure, and all that kind of stuff, and also how you can find out a bit more about that international work. But otherwise, thanks again, Jodie and the great team at North Cumbria, and we're looking forward to the next 40 minutes or so. Thank you.
Brilliant. Thank you very much, Richard. That's really great. I know we haven't got any questions, like you said, but we obviously, if there's any more questions, we can ask them all at the end. So if I just move you on to one of our speakers from the North North Cumbria, which is Dr. Stephen Lynn. He's one of our associate directors, and he heads up our commercial and economic growth team. And hand over to Stephen.
Great. Thanks very much for that, Jodie. Just to say, thanks very much for that introduction, Richard, as well. That's really interesting. And just to say, any companies on this call who haven't already engaged with the ABHI, I would strongly encourage you to do so and contact them, because they are a really supportive organisation for those SMEs. Okay, I'm just going to take a little bit of time just to give you an overview of Health Innovation North East and North Cumbria. You may remember us in a previous life. We were the old academic health science networks, but we changed our name probably about a year ago. I think it was October last year, where all of the HSNs turned into the Health Innovation Networks. So apart from the name, nothing else has changed. We're still here to support innovation in all its guises and help innovators and companies along that pathway as well. Next slide, please, Sarah. Great. So yeah, just very quickly, an overview of who we are. So there are 15 health innovation networks that sit across the whole of England. Obviously, we're the most northern one. We were, as I say, originally established by NHS England as the Academic Health Science Networks back in 2013, with the aim to help spread health innovation at pace and scale. We are commissioned by NHS England, but also as well, we are also commissioned by the Office for Life Sciences. And the commission that we get from the Office for Life Sciences is really to help support that health and wealth agenda. So it's really looking at improving population health, but at the same time supporting and generating economic growth and ideally supporting our UK-based SMEs to flourish and grow within this particular sector. Also as well, we are more and more coming the innovation delivery arm for the NHS. So we are involved in a number of initiatives and programs, which I'll speak a little bit about shortly as well. But we are supporting the NHS through the ICBs, primary care, community, and also as well across social care. Next slide, please. So each of the HINs, we work both locally and nationally, and obviously here in North East North Cumbria, we have quite a large footprint that covers this region, as you can see in the area. We're quite unique because within this large area, we also have one ICB that we work very closely with as well. So we have exactly the same footprint as our ICB, and we're here to identify innovation and improvements to specific problems and unmet needs that we address in collaboration with our ICB and other NHS organisations. And it's really to sort of help identify the most appropriate business setting for innovators to be able to bring their innovations to market and to the NHS. We also create our pipeline of innovation, so we support innovation from end to end. And again, I'll talk a little bit about that a little bit later on. We support innovators by empowering them to further their ideas and connect with the right stakeholders across our system, and also as well to accelerate and advance the uptake and spread of innovation improvements by delivering a number of national programs and initiatives within the NHS and social care. And nationally, we work very closely with the other HINs across England to create and deliver a very collaborative network to provide that greater impact, highlight success, but also as well share best practice and to share those high impactful innovations that we're able to deploy with our regions, and then look to spread that nationally through the other 14 health innovation networks. Next slide, please. So this just gives you a snapshot of what we do. We focus across these 6 key areas. We host the patient safety collaborative, so that's all around that transforming patient safety agenda. We do a lot of work in improving population health. and developing NHS innovation, which I've already touched upon, as well as supporting economic growth. We also do a lot of work around digital transformation. So again, we're very active in this particular area and have very strong links into our local system around identifying and deploying digital solutions that are there to sort of help the local system. So through all of this, obviously, we look to identify, evaluate, and adopt and disseminate this transformative information, and we do this through facilitating collaborations and partnerships across the region, and we do this through what we call our innovation pathway. So you can go to the next slide, please, Sarah. So this slide really just describes our innovation pathway. This is something that was developed all the way back in 2013 when the Academic Health Science Network was initially set up. And this really just describes that end-to-end journey for innovators to bring their ideas for transformative innovation and bring it through this whole journey of idea assessment, development, evaluation, implementation, and finally adoption and spread. So these hexagons are the primary areas of support where the Health Innovation Network can help you with. And if you go onto our website, there's actually an interactive version of this slide on there. So if you want to get a bit more information about any of the aspects of this journey, you can click on that and you can see a bit more information behind that, but also more importantly, you can see what support is available as well to help you with each of these areas of this particular journey. It's not always quite a linear journey as like this. Obviously, depending on the innovation, there may be times where we need to sort of circle back to potentially maybe generate more evidence or to do more work in any one or two particular areas as well. But we're here to sort of try and support you and take you through this journey and help you, as I say, get to move from the left through to the right to ensure that you end up with your innovation being adopted and spread across the system. Also, as well, around the pathway, we have a number of wraparound support offers as well. So we help with a lot of pathway support, marketing, the brokering, which I've talked about. So we see ourselves as being that honest broker to help you connect with the right organizations at the right time to have those most appropriate conversations. We provide a lot of help around finance and business support and funding and grant applications. So we can work with you to identify relevant grant opportunities and help you sort of develop those applications and hopefully be successful in obtaining that funding as well. And then what links to what Richard said in his talk as well about some of the international work, we can help again around some of that trade and investment work as well. That there is a lot of international support that goes on across the various health innovation networks across the country. And again, working with people like ABHI and Department of Business and Trade as well. You know, we can help you with identifying and expanding your innovation to other markets as well. So that's basically all I think I wanted to say. But just to encourage you that if you want to discuss your particular innovation and you're looking for particular help and support, then please get in touch with us. Thank you very much. I think that's my last slide there, Sarah. Thank you.
Thank you, Stephen. Really informative. There's no questions in the chat, so I will move on. I know that Jonathan has put in a link to the ABHI's international activity and as well as the SME offer from the ABHI. So there's obviously some links there. Again, if anybody has any questions, you can put them in the chat, and we can approach them after each session or at the end. You've got me for the next 10 minutes, so I'm going to talk about 2 programmes of work. So I'm also an associate director up here in the North East and North Cumbria, and we have a portfolio approach to work, and my portfolio consists of main 2 programmes. The first one is called Clinical Digital Resource Collaborative, which I'm going to talk about in a minute. But first of all, I'm going to focus on a piece of work called the Health and Life Sciences Pledge, which follows on really nicely from the work that Stephen was just talking about. You can go on to the next slide for me, please, Sarah. So the Health and Life Sciences Pledge was born from the activity around the innovation pathway. So as Stephen has just talked about, the innovation pathway is the framework and the bedrock of what creates a HIN, and especially up here in the North East and North Cumbria, working across that full pathway from when innovation enters those really early stage to when they leave, when they're at full adoption and spread within the NHS at national level, or even much further in terms of international. What we realised is that in that innovation pathway, we needed to make it less static and more interactive, and understand how we can operationalise that across the system. So we knew that we needed to create a collaborative ecosystem. HI, as it stands, doesn't provide all the services within the innovation pathway, but we work really closely with partners within the system, within that ecosystem itself, within the health and life sciences infrastructure. So what we set out to do was to create an ecosystem that allowed the infrastructure to talk together, to communicate together, to network together, and understanding that we are much stronger as a unit rather than individual organisations to support innovation, and obviously with much broader things. So for instance, leveraging investment. So what we created with communication with it, after we did some stakeholder events a couple of years ago, what the stakeholder event found out that everybody was really supportive of creating a collaborative ecosystem, and would like to do that in the form of a pledge. And the idea of the pledge is to encourage, enable and empower more innovation by bringing key stakeholders together to better communicate, collaborate and celebrate. Now this is light touch on purpose. The idea is that it's not, there's not contractual, not actually signing anything. The idea is that we work together as a unit, and we promise, almost Scouts on a promise, to work together to create opportunities and to speed up the pace of innovation. The vision itself is to bring together that regional infrastructure in the North East and North Cumbria and much broader, to gain recognition for our unique infrastructure and assets on both a regional, national and international stage. I think what the North East has over the rest of the country is we work really well together, we network really well together, and we all know each other. And I think that's something that we really should shout about, because that really helps to pace the speed of innovation. And we want to work cohesively together to identify opportunities, to attract investment to our region, and to celebrate that successful, that collective success in the innovation arena. Using the pledge, what we're encouraging other people to do is to support the reduction of health inequalities, really strongly aligning with our ICB priorities, attract and drive investment, promote economic growth, and to gain recognition as an exemplar of health and social care innovation. What I should have said is where I started. The pledge is actually it's come together through the ICB in the North East, North Cumbria and Health Innovation. So this has been brought together by the 2 organisations. Next slide, please. So in terms of the first 16 months worth of activity, we have 171 organisations signed up to the pledge, including pharmaceutical companies in all of our trusts in the North East, all of our academic institutions, as well as organisations set up to support innovation, which is way beyond what I thought it would be. I'm so proud of this work in terms of what we've achieved in this first 16 months. We've successfully supported a bid for 4.1 million in terms of investment in a regional North Futures hub. We've held 6 successful regional networking events, focusing on devolution. Potentially, we've just gone through our own devolution deal, finance, internationalisation, as well as a landscape review, looking at the different inputs of the different structures within the North East and North Cumbria. And again, we went through a rebranding in October last year, so lots of other organisations did. So it was just to sort of make sure everybody was up to date with that. We have monthly newsletters that go out full of good news stories, events, bringing that network together, making sure that everybody's aware of what's going on, and we're stopping that siloed working. We've launched our own website, which has all our pledges, what we call people, links onto the website, so you can see who's part of the pledge itself. We've just recently done a pledge survey to all the pledges, and we had over 50% response rate, which is fantastic. Really positive feedback in terms of the events and the space and the networking that we've had so far, and then for the next 18 months program of work has come from that. So really positive interactions. We've also just gone and created a pledge steering group, of which 57 of the 171 organisations want to be part of, which is absolutely fantastic. And we need to figure out a way of how we can make that steering group work, making sure that that group is able to direct and steer the activity that will happen over the next 18 months. Next slide, please. So I put this in, but I think Stephen's covered all that in terms of the pledge is essentially the operationalization of the innovation pathway. What we're doing is populating those hexagons by understanding the value add of each of the organisations. So if I'm mapping a pharmaceutical company, if I'm mapping a university, if I'm mapping a company that supports innovation, I understand which hexagons they sit in and the value add. So therefore, when an innovator comes to me, I'm able to say, okay, brilliant, you need this. I'll be able to refer you to this organisation because they specialise in that, and speed up that pace of innovation. Next slide, please. And in terms of, again, what Stephen mentioned, the interactive map. So again, all of the pledges are mapped into our interactive map to really showcase and highlight their value, and so we can speed up that pace of innovation, like I was just saying. As part of the pledge activity, we've been going to numerous events, and I've just listed a few there with the national, international and regional as well, to really drum up and showcase the pledge and the activity that we've been doing. A real highlight for me is an invitation to the House of Commons late last year to highlight the regional collaborative approach that we have, and we had a conversation with Chi, who was the Minister of Science and Research and Innovation at the time. Next slide, please. Again, this is one of my favourite slides in this presentation because it really shows what we're trying to do. So this is the pledge in action. So we've been supporting Asia, and Asia runs a company called SenSmart. We've been supporting Asia for a couple of years now, and working with Asia, I realised that actually Asia is working with a high number of different companies, and you can see them, all their logos on the side there. And the idea is that we work as a collaborative to support Asia to develop her product. What Asia has developed is an interactive menu board that is a traditional menu board would be something you would see in a hospital, which would potentially be a bit of paper with your food options written on there. What Asia has created is something much more interactive, where it's digital, so it can speak to you in terms of different languages, but it also has scent pods attached, which I think is where the real innovation comes in. So people can smell their food to really try and stimulate people who might be suffering from Alzheimer's, dementia, or a disability, to try and really stimulate them to eat. And you can see just by the number of people on there that by working together, we're able to support Asia in a really collaborative, fantastic way. And because of that, Asia had a showcase with the BBC, and she was featured on the BBC Breakfast Show, really showcasing the work that she's done. Next slide, please. So the next steps, we've obviously had the survey results back, and that's just quite recently we've gone through that, overwhelmingly positive in terms of the next level of steps that they want to take. Everybody's really positive in recommending the pledge to colleagues and to other organisations to join. We've got an 18-month plan of activity for pledges and innovators, so mapping together events that pledges potentially can deliver to the innovators and activity, as well as internationalisation events and a steering group, which I've already mentioned. So again, if anybody's interested, next slide please, Sarah. So if anybody's interested in becoming part of the pledge or learning more about it, please get in touch. We have got our own pledge website, and that's my email address there. Very welcome to have a conversation about the activity that's happening up here in the North East, and as a really collaborative space that we work in. Fantastic. So I've got no questions in the chat, so I will carry on with my next presentation, which is the other part of my portfolio is that I lead out as National Implementation Lead for CDRC, and CDRC stands for Clinical Digital Resource Collaborative, and this is a flagship programme for HI in the North East and North Cumbria. Next slide, please. So what is CDRC? It's a collaboration between HI, NEXT, which is our commissioning support unit, CBC, which is a federation, and a Cumbria Primus, which is an organisation that develops clinical resources. We work together to develop clinical resources in System 1 and EMIS. It's an NHS-owned digital resource with national reach, and we enable and deliver gold standard patient care efficiently. We are putting clinicians back in control of their patient care, providing the appropriate resources at the right time to improve their patient outcomes. Next slide, please. What our mission is to prevent clinical teams reinventing the wheel by providing a central repository of resources that people can access. It's free at point of use across the country. So again, developing our free resources in the clinical systems, EMIS and System 1, that can be accessed by primary care. Thank you. So our team we work across a number of different organisations, hence why we're collaborative, where we have our founders. We have Dr. Gareth Forbes and Dr. Jonathan Harness, both our co-founders. Then we have our clinical lead. You've got Andrew Richardson-Black and Tom Zawowski. And then we've got the rest of the implementation team. So we've got myself, Billy, who works in NEX. Ben is our programme manager. And then we have one of our comms and marketing team in HI to lead out on our social media. So what do we do? What do we provide? So clinical reports, patient searches within the clinical systems to identify specific cohorts of patients, data entry templates for accurate review and assessment or coding of patient data, referral forms. We have some great work in terms of the suspected cancer referral forms, where we're validating regional referral forms, looking at pre-populating them, so we're pulling through the data from the clinical system itself. Patient safety alerts and icons, either soft or hard, in terms of their pop-ups. Visualizations, which is another word for dashboard. So again, making it easy and visually pleasing for people to see across system working what's happening within their practice. So you can look at, for instance, it could be anything from hypertension rates, CKD rates, etc. within your own system. But again, if you zoom out from that, you can also look at a much broader level in terms of PCN level or primary care level. We could develop questionnaires within the system, protocols again, and all of our products that we develop are hazard reviews by our partner NEX, which means that they're safe to use. Next slide, please. Who are they for? So it's for healthcare professionals managing individual practices, our patients in practices, healthcare professionals wanting to sort of lead on a particular work, looking at particular cohort of patients. For example, it could be a piece of work around CKD and you're really focusing on there within your practice or within your PCN. Admin roles looking to manage long-term condition management, for instance, the annual reviews. So it might be the process around that. Or again, zooming out from that, you've got your PCN, ICS, ICP level for population-based information, so really informing what's happening in the space. So you can look at, again, I'll use the CKD as an example, where if you wanted to look at undiagnosed CKD, you could look at it from an ICS level and understand which areas needed a little bit more support or needed support with helping those patients, and which ones are the good areas, and look at their good practice. Next slide, please. So again, in terms of its benefits, it's time saving. So obviously all our resources are pre-designed. So you just need to find, if you're on System 1, join the group itself, and then you have access to all our resources. And the same with EMIS, you just upload the resource itself, and they're all there redesigned and validated in terms of safe. It's free to use. There's no point of use. It's free to use. Obviously, we work with companies, and we work in terms of charging those companies to develop the products, but it's free at point of use. We don't want to create health inequalities by preventing people from accessing these resources. It's an opportunity to increase practice income, and to improve their performance management, working with their the QOF or the IIF, and it's flexible implementation. So clinicians can choose what resources they want to do. If they just want to focus on hypertension, if they just want to focus on particular QOF points, then that's absolutely fine. But if they want to look at a number of things, again, they just pull through the resources that they want. Next, please. So I've just pulled through a couple of examples of some of the work that we've done just to put it into real life for you. The next slide is so familial hypercholesterolemia. Again, it's a huge problem globally. 34 million people undiagnosed. That's 80% undiagnosed. and looking at how we can use CDRC resources to really help with that population in the North East and broader nationally. So we worked with the lipid specialists to create powerful searches to identify people with possible undiagnosed FH, but sensitive not to overwhelm the system. So I putting in a process so we understand that we don't want to diagnose, we don't want to flood the system with hundreds and thousands of people that need to be reviewed. Next slide, please. So again, we use this project to identify families that were at risk. So by identifying a person that was at risk of FH, we were able to use that cascading testing or genetic testing to make sure that their family were prevented. So it's using it as a preventative measure. So one person was diagnosed, we were able to identify from that same family there was 2 children potentially at risk, and therefore could perform a medication to prevent any events from happening. So it's as a preventative measure itself. Next slide, please. So again, this is just a real quick view about the hypertension diagnosis. So this was a pilot within Derwentside, which is a part of County Durham in the North East and North Cumbria. We were really specifically looking at undiagnosed hypertension as a common problem. So you can see from the little table in the corner, I've mapped through the England average against the Durham average, against the Derwentside average when we were putting in this pilot in stage. And you can see at 2003 that the England average was about 14%, a little bit higher for the County Durham average. And you can see the average of undiagnosed, because we were finding these people, was 20%. So you can see there was a huge difference once the CDRC search was put into place in that area to identify and pull through these people. Next slide, please. And again, the same with identification of people with undiagnosed diabetes. You can see in the table in the corner that the England average and the Durham average stayed around about, looking at that, around about 6%. Well, once the intervention was in place, we were able to pull through and identify 7.5% of people at risk. Therefore, those people were then medicated, diagnosed, and appropriately put on the right pathway, preventing anything from happening, and obviously cost saving, time saving, etc. And you can see the real impact there. Next slide, please. If you do have any questions, I know that is a real whistle top because I'm aware that I had 2 presentations to do in that time. If anybody would like any further questions, please get in touch either about the pledge or CDRC. Very happy to have that conversation. I think Rachel has answered the question for me in terms of the pledge, so thank you very much, Rachel. So I'm going to pass you on to Rachel Morris, who is also an Associate Director over here in the North East, and Rachel is our commercial lead for our secure data environment.
So I'll try and fit all these slides into the last 15 minutes that we've got. So if I rush through them, just like I say, you have opportunity to pop questions in the chat or ask them at the end. 2 seconds. Sarah, sorry, I'm just going to take over the slides. So in terms of the secure data environment, the North East and North Cumbria is a subnational secure data environment. And this slide shows where the SDE is kind of originated from. And you can see that this all started back in April 2022 off the Goldacre review. And then there was the Data Saves Lives strategy, and then a policy update in October 2023 that said that the data access by default should be the way that we go rather than sort of data sharing. There's a policy shift to data access, which means that NHS England are encouraging people to have access to the data rather than taking the data out. And like I say, sharing data across different organisations where it could sort of lose its validity. So the concept of an SDE is that there'll be a national SDE and then 11 subnational SDEs. And like I said before, we are one of those 11. So we are the North East and North Cumbria SDE, and these are the others that are available to access around the country. You'll be able to access that via a national front door, or you'll be able to access that locally by each of the individual SDEs. So depending on the type of project and what data you need, and we'll be able to help either on a local level or at a national level. So this is kind of our geography. ties into what Steve said earlier. So we're quite lucky in the Northeast and North Cumbria in terms of our geography. So our SDE matches sort of our NHS geography, our ICB, and also, we've got sort of that high NENC matching geography, and also what was our CRN that's now changed to the RRDN and other geographies that kind of map nicely to the Northeast and North Cumbria. We're quite lucky in a sense that we've got sort of one ICB, and it's a lot simpler than some of the other areas across the country. The funding that we've got at the minute will last until March 2025, where we'd look to make our local SDE sustainable and be up and running sort of business as usual from April 25 onwards. So we're just going through that process now. We do have a technical infrastructure in place, so that is provided on an Axiom platform, which is hosted by Nex. We have dedicated PPIE, comms and IG groups to make sure that we're complying with a lot of sort of the national requirements around the SDE, specifically around patient and public engagement, and also the information governance relating to the setup and the control of the data once it's in those secure data environments. I'm the commercial lead for the SDE for the Northeast and North Cumbria, and we're undertaking a commercial scoping exercise at the minute. And this is to ensure that as a national SDE, all of the 11 subnational regions are aligning to sort of common principles and common pricing models to ensure that there's consistency for researchers, regardless of what area you want to access in terms of that data. For us locally, so we have test projects underway within our SDE at the moment, and like I say, from April 2025, we're hoping that that will be sort of open for business, and we'll be able to take in multiple projects. That's not to say we can't taken any projects now. So our SDE is live, the technical platform is in place, and we are able to take projects through our SDE at the moment. However, we've just had our Section 251 for research purposes approved last week, which is a great step forward, and that will allow us now to build sort of our data access committee and put sort of formal mechanisms in place to be able to run projects in a much more efficient and streamlined way. So at the minute, if you wanted to undertake a project, you absolutely can. It just might take a bit more sort of regulation and sort of project setup than what it would when we're kind of in that sort of business as usual operating model where we have that Section 251 in place and also our data access committee. So for those that don't know what an SDE is, I mean, I'm assuming you probably all do, but just in case anybody on the call that doesn't. So the secure data environment effectively is an online cloud-based data access platform. So a researcher would come with a research proposal. It would have sort of questions that they wanted to answer, and they would need specific data sets in order to answer those research questions. So what the secure data environment does is it moves from a data sharing model to one of a data access model. So it will bring that data into a secure environment where the users of that research team can access the data, all of the analysis, so all of the sort of statistical and software tools that are needed to perform the analysis on the data will sit within the secure data environment, and that team will be able to conduct the research on that data within that environment. No data can be taken whatsoever from the SDE, and this just means that sort of it's a like I said earlier, the data has more validity, and there's sort of no sharing, no copying of that data. Researchers can take the results of the data out of the SDE, so the findings, but the data itself cannot leave that environment. So in terms of the features of our SDE, so it allows accredited staff across different sectors to collaborate on projects in a safe place. So I guess one of the key selling points of the SDE is being able to create that linked up joining of records or data sets. So for example, historically, if you wanted to look at particular data sets of particular patients, you might be able to do that in silos across different sectors. So for example, primary care or secondary care. And what the benefits of the SDE will allow you to do is link those data sets. So you have the ability to look at sort of full patient pathways, but you also have the ability to look at sort of wider socio-economic impacts of your research. So we do have the ability to be able to link up in the future with sort of local authority data sets, police data sets, ambulatory data sets. So you just get a much wider view of kind of that patient pathway or that data set rather than just looking at in a particular sector. the data access committee that I was talking about earlier, that will allow researchers to come in, and it will hopefully allow for a much more efficient and streamlined process of approving research proposals. So the data access committee will be made up of the correct sort of information governance and regulatory bodies from across the region to approve those processes, those projects, sorry, through that process. And it will also have elements of some of the other things that I mentioned earlier, like the PPIE elements, etc., will all be built into that sort of data access committee and that approval process. So this is the vision for our SDE. So we would ideally like to make it a default way for research and development on data for across sort of the entire health and care data sets. Like I said, not just looking at specific ones, but across that entire health and data care pathway. It will give a sort of a single route in for that for researchers, whether that's the local route or a national route. It will ensure that the data remains secure. And it also will be subject to accredited bodies. So we will have sort of stringent processes that we have to adhere to, and we will be audited annually as part of this. So we do have to conform with a lot of also sort of national sort of national security and confidentiality standards as well. So some of the problems that the SDE aims to solve is sort of the challenges that people have had in terms of accessing for data data for R&D purposes in the past. So from a researcher perspective, this can be where do I find the data, who's the data controller, and getting all of the different approval processes in place. Especially if your data sits within different organisations, that can make it really challenging. And then linking those data sets could be a really challenging task also, if it again sits across different sectors. In terms of the exercise that we've done with the public are really keen to know kind of what projects would be undertaken and how their data would be used, and whether this could be an opt-in, opt-out, and how are they involved in the decision making. So we've done a lot of work with our our patient and public involvement groups. And there's been recently just been sort of a national piece of work undertaken with a huge sort of PPIE group that have indicated that quite a substantial amount of the public members are in favour of the SDE and what it is trying to achieve, and sort of the security that sits around that. Also, it means in terms of this data controller for the SDE, for the North East and North Cumbria SDE, we will have one data controller, and that will be our ICB. And what we then need to do is we need to move into our sort of next development phase, which will be working with our data providers. So in terms of our geography, there's probably almost 400 data providers that sit within the North East and North Cumbria, and we will work with each of them to make sure that they are happy to sign up to a data sharing agreement, and they will then be able to share their specific data sets to the SDE for the purposes of research. So from March 2025, hopefully when our SDE is up and running as business as usual, it will give all of the people who are wanting to kind of access those data sets for research purposes a standardized way of doing so, a standard approval process. It'll give sort of the public reassurance that this is being done in a consistent manner and in a really sort of strict and well-governed manner as well. And like I say, we've got our ICB is now our single data controller, so that kind of makes it much more streamlined for the North East and North Cumbria. I think I probably covered sort of the benefits of the SDE, but it's safer for the data. There's no copies that can be made, and like I said, there's a lot of accreditation processes that we have to go through in terms of being able to have this set up and then running from a day-to-day use from April 25. I'm just trying to whiz through, sorry, in the interest of time. But like I said, we will have our own data access committee, and we'll have sort of in time what that will mean once we have sort of those data sharing agreements signed from our data providers. It means that effectively the North East and North Cumbria will have their own sort of R&D data repository. We will build a catalogue for that, and that will be very transparent. So you'll be able to see kind of what data sets we hold, what research has already been done, and that will give sort of users wanting to access our data sets for the purposes of research that ability to see what we have available, and that will be replicated nationally. So it won't just be our SDE that will do that, all of the SDEs will feed that into a national gateway, and that information will be available on a national level as well. You can obviously access the SDE locally for our local data sets, but we do also have the ability to link that up with the data sets kind of from other SDEs also in the future. So what our section 251 allows us to do is it allows an application for us to approve those R&D projects for the purposes of data research via our data access committee, and it allows us to kind of give sort of a single sign off for that. The next steps in terms of what we're trying to achieve for the SDE as a whole is to be able to also submit a Section 251 for non-research purposes. So looking at kind of the priorities that we have to achieve before the end of March 2025, one of the key ones was to have the research Section 251 signed off, which we've now achieved. So we want to start looking at what that means for non-research Section 251 to be able to undertake audits and service evaluations and sort of use our data regionally for sharing best practice and for learning. We need to get our data access committee sort of set up and approved. Our technical platform is in place. We want to make some amendments to that, some developments to that. So we're just about to undertake a technical development piece of work to the technical platform that will allow us to sort of explore the multimodal data sets being imported into the SDE, and also looking at how we can get imaging and sort of our more complex AI projects set up within the SDE as well. Like I said, we hope to be able to generate our own data repository where we'd be able to have our own data catalogues, and people will be able to see what we do have available within the North East and North Cumbria. We will go into sort of a public communication campaign so that the public are aware that this is coming, and we will obviously implement that opt-out availability for our public. A stakeholder engagement exercise will be undertaken. I think that's planned for November, where we look to kind of harness the information from our stakeholders across the region, whether that's industry, NHS, academia, local authority, to undertake a demand planning exercise so we could understand what this will look like from April 2025. And throughout the process, we do plan on continuing to engage with our patient and public involvement groups as well. And we do have recently completed an exercise where we've developed a full end-to-end process of sort of user experience from coming into the SDE, proposing a research question, going through sort of our initial triage processes and working that up from project support to delivery of a project within the SDE. So I'm really sorry that was really quick, but I hope we can share the slides. We've got a dedicated mailbox for any inquiries for the SDE, and we've also got a website, and also you can sign up to the SDE mailing list as well. But sorry, Jodie, that was really quick, and I can see some questions going in the chat, so I'll stay on.
It is, and apologise, Rachel, because that was probably my fault that you were so rushed, because I went over a little bit with my presentation, so apologies. But if there is any questions for Rachel, she's very open to having an email sent to her. But there is a question in the chat from Hannah, which is she's involved with an SDE. Are you having conversations around linking with primary care data? It's a national level question that ABHI members are particularly interested in to track what happens to patients once they are managed locally.
Yes, absolutely. So our plan is completely to link data sets as far and wide as we possibly can. So when we're undertaking that exercise in terms of those data provider engagement strategy that we're about to go into, they will be sharing a data, well, hopefully they will all sign up to our data sharing agreement, and that data sharing agreement will allow us through our Section 251, as long as it's for the purposes of research, and then hopefully for the purposes of audit, like I say, audit and evaluation, once we get this non-research 251 in place, that will give us the ability to link the data sets from a wide range. And from first of all, if we get all of our data providers signed up, that will be primary care and secondary care, and then we'll look to kind of expand that into more areas such as community care, and like I mentioned earlier, hopefully local authorities, police state, and we're also in discussions with our local ambulance service, NIAS, and they're quite keen to get involved as well. So we'll also have data sets from ambulatory care as well.
Wow, amazing. Thank you, Rachel. Okay, so I think that comes to the end of the presentations. If the speakers, or if everybody would like to put their cameras on, if there's any more questions, now's a good time to ask them. Let me just sit that one. But I'd just like to say a quick thank you to our speakers. So we've got Richard for the introductions, obviously Stephen for the work around health innovation, Rachel on the SDE. So thank you very much. And if anybody's got any questions, please feel free to email any of our key speakers. Otherwise, I will let everybody get on with their Friday. Thank you.